Hi there, I'm Tatiana. I am a psychologist and psychotherapist working in London, in Canary Wharf, also working online with online therapy. The purpose of this video today is to talk about the seasonal affective disorder, SAD, and just to talk a little bit about it so people can understand what it is, how it manifests, and also talk about the treatment and talk about how to differentiate from other types of depression or even other types of mental health problems. I'm also going to talk about vitamin D and how this could be connected, the issues around vitamin D and deficiency, how they can be connected to symptoms related to depression and to the seasonal affective disorder. So the purpose of this video is to raise awareness, to understand a little bit more about that, and also to help people to, let's say, see through the sea of information that's online. And sometimes we can read diagnostics online and feel quite overwhelmed, thinking, oh, I've got this, or I've got that, or I have more than one disease. And the purpose of this video is to demystify this idea and get a little bit better understanding of what it means to have this particular disorder. And also, if this is not the case, which is most likely, because there are not that many people suffering with the official diagnosis of this disorder, what to do. That would be another video, but it's important to know that it's quite specific. So let's get into it. What are the symptoms of the seasonal affective disorder? They are very, very similar to depression. The person can feel irritable, can feel persisting feelings of sadness, deep sadness, very, very deep sadness, sometimes feelings of despair, suicidal thoughts and feelings, lack of energy, lack of enthusiasm, lack of pleasure, difficulty enjoying activities. It can be difficulty engaging with normal activities such as work, studies, or other commitments. So very, very similar to depression. It is a type of depression in my understanding. And the person can also feel very sleepy during the day. It can be difficult to stay awake during the day, and at the same time, difficulty sleeping at night because has been sleeping during the day. So some dysregulation in the sleep and wake cycle. So these are the general symptoms. Of course, there are others, but these are like very similar to depression, as I said, and a persistence of these feelings and difficulties can indicate the presence of this disorder. But to call a disorder, it means that it has to be persistent. And also the characteristic about that really defines seasonal affective disorder is that it happens during the autumn and the winter time in the northern hemisphere when it's cold and dark. So it seems that the change of season into those darker, colder months really triggers the depression or the seasonal affective disorder, because it's a mood disorder, affects your mood and your enthusiasm and your energy levels. So it's a mood disorder. Of course, it will affect your thinking and will affect your feelings, but in general, in the psychiatric system, it is a mood disorder. So about 6% of the UK population suffer with this disorder. So is there, but it's not something as prevalent or as common as anxiety and depression in general terms, which affect a lot more people. So, and to identify this particular disorder, this seasonal affective disorder, you will need a few years of observing yourself, noticing that during those months, that's when the depression kicks in or those difficulties kick in. And as soon as the spring and summer start again, more sunlight, more heat, the symptoms diminish or disappear completely and you live normal life. So there's quite a difference, quite a significant difference between your well-being and your feelings of enjoyment of life, pleasure, efficiency, energy levels during those warmer months than in the winter months, the colder months. In the body, there are a number of things happening. There is a high level of melatonin, which is the hormone that makes you feel sleepy and tired. It makes you go to sleep and have a deep sleep. So in the people with this disorder, has been identified there is a high level of this substance in our bodies. There is a low of serotonin, which is again present in depression, which is something that is making you feel all those difficult feelings. And there is this out of sync between the wake hours and the sleep hours. The body clock is out of sync. So these are things that are observed in the physiological changes. So there are medications. So I'm moving now into treatment, okay? So as I said, there are physiological changes. The treatment can involve different types of antidepressants. Another part of the treatment many times is to use a high power light lamp that, triggers your brain to believe this is still the summertime or the springtime, with a very, very bright light that has to be on for a number of hours during the day, and it comes on early in the morning. So it helps your body to feel like it's the summertime, or you live in a tropical country, for example. Psychotherapy can help, of course. It can help to build your resilience. It can help to build the resources, internal and external, in your life, eliminate things that are not helpful, to really make you stronger and being better able to deal with the fluctuations of the seasons. It's not going to heal the symptoms, but it's going to work at the base of your personality, of your personal traumas or your environmental issues that may be making you more vulnerable to those oscillations in the temperatures and the light. So it can make you stronger to deal with those. It can work alongside medication. It can work by itself, but that depends on how much is affecting your life and your own preferences and your own issues around use of medication. There is a lot about that in terms of learning about yourself, learning about self-care, that can really help you to deal with this issue in a different way, in a more resilient way. And now just a quick word around vitamin D deficiency. So I spoke about the symptoms, I spoke about the treatment, and as I said, there is something about this disease or this disorder that is quite specific. So it only happens during the autumn and winter time. So if those feelings of depression, those feelings of lack of enthusiasm and irritability, lack of ability to engage with life are happening for longer periods and across the seasons, that is not this particular disorder. There'll be something else. So it's important to observe that for a while before jumping to the conclusion that because this time of the year, in the winter this year, you're feeling like that, doesn't mean you have this disorder. So it takes quite a while to have a proper diagnostic. And as I said, I'm going to talk a little bit about vitamin D deficiency, which some people are aware of and some doctors are aware of, but not everybody is. But vitamin D deficiency is a huge factor that brings all the symptoms very, very similar to depression and very, very similar to the seasonal affective disorder. For people who have vitamin D deficiency, they can feel all those feelings, but they are actually caused by a lack of vitamin D in the body. So everybody's different. Some people can produce vitamin D because we produce vitamin D is stimulated by the sunlight. So some bodies are better at producing it and keeping it, and other people have more difficulty with that. Only a doctor can do a test. A blood test is very easy to do to check it out and see your levels of vitamin D. So before embarking on a long course of psychotherapy that will, do a lot of soul searching, it's good to check it out if you're not having just a vitamin D deficiency that could be bringing all the symptoms very similar to depression. So I'll put a link down there as well for people who want to know more about it. It's a very, very important piece of information. And I always recommend people to test it out before doing all the other work, you know. And okay, so as I said, this disorder is not that common. Okay, it's common, but it's not very, very common. But what about these people who are, and I include myself in that, who do feel a little bit down at this time of the year, especially as I grew up in a tropical country where there was sunlight all year round. Moving to Europe has been quite challenging for me. What about us that are not officially diagnosed with this disorder, but still struggling through the winter? I ask you to watch my next video, which is going to talk about the meaning or the psychological aspects of winter time and how to look after ourselves better during this time of the year and make it an enjoyable and nurturing time, not a time of stress and depression, which can very easily become. And then when the new year comes along, there will be a lot of stuff to deal with. So trying to avoid that, and also looking for the deeper meaning, the deeper aspects of our psyche, you know, in terms of what does it mean to go through the winter, to go through autumn, preparing for the winter and going through the winter, and how to look after ourselves in a healthy way. So I hope this is helpful, and I see you soon.